As health professionals, we look to research and guidance to make decisions and help patients in their decisions about the types of care we deliver and the types of preventative screening we perform. In instances where all the leading scientists agree, it makes it super easy to inform patients and make a decision. But in some instances, there is disagreement about what the best approach is. We look for guidance from the American Cancer Association, the United States Preventive Services Task Force, as well as other bodies such as the American College of Obstetrics and Gynecology, Urology, Hematology and Oncology, amongst many others. When we're talking about prostate cancer screening, this is an area where there is a bit of debate about what the right screening approach is, and that can make it really confusing for patients. Essentially, the guidance is that it should be an informed decision that each patient makes based on what they understand their risk to be. And it's our obligation to help try to guide that decision and answer any questions. So risk factors would be an individual who has a strong family history of prostate cancer that was identified at a young age in a family member or in multiple family members. There are some occupational risk factors, and we know that all cancers are in higher incidence in certain occupations. Firefighting is one of those occupations. There are a few ways that we can screen individuals. PSA blood testing, prostate-specific antigen, is really the most important way that we test, and that's done through a simple blood test. Now, not all elevated PSAs mean an individual has prostate cancer, and that usually will mean further testing is necessary. That further testing, including prostate biopsy, is one of the reasons that the USPTF recommends that we need to be really careful about the screening that we do, because they put a lot of weight on the anxiety that's created from the testing, as well as the anxiety and pain that may be generated from unnecessary biopsies in individuals who don't have prostate cancer. And so an individual at high risk should certainly at least get a PSA test done every single year. And I would say the majority of our patients opt into that. The real question comes with regard to the digital rectal exam, a provider putting their finger into the rectum of the patient to feel the prostate. We can only feel one half of the prostate, but that's the half where 80% of prostate cancers occur. There is some thought that a prostate cancer needs to be pretty large by the time that a provider would be able to feel it, and typically a patient would have developed symptoms by then. But an individual at risk may feel as though the best way to identify any early prostate cancer would be by getting both the PSA blood test and a rectal exam. Everyone would recommend that if a PSA blood test is elevated, that we go ahead and do a rectal exam to feel for any tumors or lumps or enlargement. For some of our patients, they're getting their exam after they already know the result of their PSA blood test. It makes that an easier decision. But for some individuals, they're getting their exam before or on the same day that they're getting their blood work. And so since they don't know whether their PSA is going to come back elevated or not, it may be worthwhile to consider getting the rectal exam on that date, just in case. Certainly we respect each patient's individual decision, and if they aren't comfortable with a rectal exam, we would respect that. But we do want to let everybody know that we do this every day, and we don't think twice about doing it. It's not something that's uncomfortable or embarrassing for us, and we want you to feel comfortable in the decision that you make. Everything I've spoken about is with regard to those who are asymptomatic. They have no symptoms of prostate cancer. It's important not to confuse that with screening or testing for those who have symptoms. So if a man has difficulty starting their urine stream starts and stops, they're getting up several times a night to urinate, or they have to go frequently, they urinate and then leave the toilet and realize that they don't feel like they completely emptied and need to go back, or they have leaking urine after using the bathroom or otherwise into their underwear. Those would all be symptoms of prostate cancer, and those individuals absolutely should get both a PSA blood test and a rectal exam. The other thing about prostate cancer screening is that it is tied somewhat to age and life expectancy. Because prostate cancer is a slow-growing type of cancer that takes a long time to become lethal, individuals who are at very advanced age or who have other medical problems that we would expect that they wouldn't outlive the prostate cancer, it may not be worth doing the testing and creating additional anxiety knowing you have another problem that isn't going to be relevant to your long-term survival. For younger individuals, especially younger individuals at increased risk though, early detection provides the opportunity for early intervention and much better outcomes.